later saw the son with multiple myeloma. So don't worry too much, don't lose any sleep if you do have a family member with myeloma.
Dr. Kyle? Dr. Kyle, my husband is 86 years old. He was diagnosed last year when he was 85 with multiple myeloma. He is in what is called the smoldering stage. He is pretty much asymptomatic, except he has lost some weight. He is refusing all treatment at this time due to his age, and he has COPD, and he's very prone to get pneumonia. He has had pneumonia 19 times.
The question is of a 86-year-old patient with smoldering multiple myeloma. First of all, I would say your husband is very wise in refusing any therapy, because patients with smoldering multiple myeloma should not be treated. They have a risk of progression of 10% per year for the first 5 years. So at the end of 5 years, half of the patients with smoldering myeloma are still smoldering. For the next 5 years, the risk of progression is 3% per year. And then after 10 years, it's 1 to 2% per year. So the longer you smolder, the better it is. So with a diagnosis of smoldering myeloma, don't be treated. The frequency of pneumonia in your husband, the smoldering myeloma could be a contributing factor by the fact that it's characterized by a reduction in one of the uninvolved immunoglobulins. But again, many patients have low immunoglobulins and never have an infection. So bottom line, just be sure that your husband does see his physician on a regular basis and monitor this, and the odds are in favor of his continuing to smolder.
I have a question. I guess it would be for Dr. Kyle. The committee that's looking at the light chains and how they are used, are they also trying to put out to laboratories to make it standard, that it's always reported in either deciliters or liters, and so you don't have this confusion?
Well, the question is the reporting of the free light chain in deciliters or liters. Well, the International Myeloma Working Group consists of about 120 physicians and scientists around the world who are interested in multiple myeloma. And this paper that Dr. Finlay alluded to was the first author was my colleague Angela Dispenseri, and this is a summary of what everyone agreed to. And as you know, when you have a large number of people, it's very difficult to get everybody to agree, and not everybody agrees 100% with everything, but this paper is a good overall consensus. Now, the problem with milligrams or per liter, this is the metric system, and this is done all over the world with the exception of the United States by and large. And so when we talk about deciliters, we're the people who are out of step, and you just quite frankly have to live with the milligrams per deciliter that you usually see in this country versus the milligrams per liter that you will see abroad. And hopefully we'll get around to adopting the metric system someday. We were close about 30 years ago, but then we backed off, and we're still in the hinterlands.
If you have if you achieved complete remission both before and after a transplant, how do you know whether you should continue treatment of some sort while you're in complete remission after the transplant?
In short, should there be maintenance therapy after transplant? And there is nobody on the face of this earth who knows for certain. There are many opinions, but the data is not solid. Maintenance in general will prolong the period or the time to progression, but we don't know if that has anything to do with survival or not, because if the patient is followed without maintenance therapy, at the point of the relapse, if that patient is treated, we don't know whether there is any difference in the overall survival. And the overall survival is the real bottom line. So in answer to that question, we don't know whether maintenance is really beneficial or not. And I personally think that there is no such thing as a safe drug, and any drug that you would take for maintenance does have potential side effects. And unless it's proven that this will prolong survival, I think that a patient should not be on maintenance therapy. Unless they're on a prospective randomized study in which the patient has the transplant and then randomized to receive therapy or not to receive therapy. Those are very important types of studies and ones that we need to continue to do, and you as patients need to present yourself for this type of study.